In the United States, about 500,000 people die each year from tobacco-caused disease. But in the rest of the world, about 6 million plus people die each year from tobacco-caused disease. Estimates are in the 21st century, we may see 1 billion deaths caused by smoking unless current trends change significantly.
The Nicotine Dependence Center started about 27 years ago now. Dr. Richard Hurt and a counselor began the program, and since that time we've treated well over 50,000 patients for tobacco dependence.
I was a lifelong smoker. I started when I was 16, when I started driving a car, and probably smoked a pack a day for 41 years or more.
A lot of people think that people who smoke, people who use tobacco, or just have a bad habit, and they just need to quit. And it's true. That's the bottom line. They need to quit. The problem is they can't. So our goal is to provide hope and healing for patients who are caught in tobacco dependence.
And we see them in a couple of different capacities. We visit patients who are hospitalized. We see about 1,500 patients per year as outpatients. And then we have a unique residential treatment program that people come and live here for 8 days.
I had been offered an opportunity to go to the residency program as a patient, and I thought getting away from all the little things that trigger me to smoke would be the best thing for me.
I was so scared, but we learned so much, and they just give you all the tools that you need to be able to accomplish your goal.
Some of what we bring to the table is an approach of meeting the patients where they're at. If you're feeling scared, it's okay. We can talk about that.
We do it through an effort of behavioral treatment provided by our tobacco treatment specialist counselors, evidence-based pharmacotherapy, which combined with behavioral therapy has been shown over and over again to be the very best treatment. We concentrate on relapse prevention, so we want to teach people how to live a life free of tobacco.
No more just one cigarette. You can't do it. Once you're done for life.
I was bound and determined that I was not going to fail, and this was going to be my ticket. So it's the best thing that I ever did for myself.
Our Nicotine Dependence Center is not just focused on treatment, but we realize that we're a relatively small group and that we need to expand our reach. And one of the ways we've done that is to develop training for health professionals.
What I think is special about that program is not only does it provide you with the knowledge to share with patients, but it has a foundation in motivational interviewing, which is a counseling communication style to enhance motivation and empower patients to make changes in their lives.
We treat people to be counselors. We have physicians come to learn about how to treat tobacco dependence, and we've trained hundreds of people across the country who are now carrying on the mission of treating others who have tobacco dependence in their communities and in their medical centers.
Do you ever use it as a reward?
The research and the science and the treatment that we have learned and shared with others becomes this guiding light that allows patients to kind of remove that shroud, and they become empowered themselves to be able to say, I can do this, and I can use these tools to be successful, and to be present with them and watch their life change in that moment is an incredible feeling.
The idea is to increase our reach. We know that as the epidemic spreads to low and middle income countries particularly, that we need to have health professionals in those areas who are trained to treat this.
Global Bridges is a worldwide network of healthcare professionals dedicated to advancing tobacco dependence treatment and effective tobacco policy. Global Bridges is coordinated by Mayo Clinic and the American Cancer Society and funded primarily by Pfizer's Independent Grants Unit, but our real strength is due to our regional partners.
Tobacco dependence in Jordan and the Eastern Mediterranean is on the rise. This is expected to cause a significant increase in non-communicable diseases. In the face of all that, Global Bridges came at the right moment.
The primary focus of Global Bridges is to build capacity so healthcare professionals can help their patients stop using tobacco. So far, we've trained over 3,600 healthcare providers representing 62 countries, and those trainees will eventually reach 1 million patients with more effective care.
Our goal is not just to provide current best treatment. We want to actually define what is best treatment. So one of our goals is to do research, to create new knowledge about how best to treat them, and maybe someday end this.
We can end the tobacco epidemic. We know what to do, we have work to do, and we need to get it done.